The dangers of vaginal prolapse. When Mary Ann first felt that weird bulge and a bit of pelvic pressure, she just chalked it up to getting older. But when she noticed something actually sticking out and had a few oops moments with her bladder, she thought, okay, what's going on? She chatted with her gynecologist and found out it was a vaginal collapse or pelvic organ prolapse. It was pretty surprising, but it started Mary Ann down a path of getting informed and finding the right treatments. Hi, I'm Clarissa from OurDoctor, and today we'll be discussing vagina collapse. What is it and how do you treat it? Pelvic organ prolapse is often misinterpreted by the public as a collapse of the vagina. Imagine the inside of the vagina like a U shape, supporting various organs, the bladder at the front, the uterus or small bowel at the top, and the rectum at the back. When these organs start to droop or push into the vagina, that's a prolapse. A cystocele is when the bladder wall bulges into the vagina, and a retrocele is when the rectum wall bulges into the vagina. If you experience this, you may need to have a procedure known as a anterior and posterior repair. This treatment lifts and tightens the tissue around the bladder and rectum so these organs no longer push against the vagina. Around 40% of women might face this at some point, but only 12% really feel its pinch. While it might sound scary, it's not life-threatening. It's more about how it affects your day-to-day comfort. Some women might feel a bit of a bulge, kind of like a tampon not placed right. Others could experience back pain, bathroom troubles, or even pain during intimacy. Here are the symptoms of pelvic organ prolapse: feeling of heaviness or fullness in the pelvis, visible bulge or protrusion of tissue from the vagina, sensation of something falling out of the vagina, discomfort or pain in the pelvis, especially when standing or being active for extended periods, urinary issues including urgency, frequency, incontinence, or difficulty starting to urinate, bowel movement difficulties like constipation or feeling that bowel doesn't empty completely, dyspareunia, which is painful intercourse, lower back pain, spotting, or bleeding in some cases. This weakening can arise from various causes. Childbirth, especially involving multiple births or a large baby, can stretch and weaken the pelvic muscles. As women age, their pelvic floor muscles naturally decline in strength, and this weakening is further exacerbated by the reduced estrogen levels during menopause. Surgeries like hysterectomy can sometimes lead to a weakened pelvic support structure. Factors such as chronic constipation and persistent coughing from conditions like bronchitis or asthma can strain the pelvic muscles. Regularly lifting heavy objects or being obese also places extra pressure on these muscles. Some women might have a genetic predisposition to prolapse, and those with connective tissue disorders can be particularly susceptible. Furthermore, prior pelvic surgeries might compromise the strength and support of the pelvic organ. While many risk factors exist, not every woman with these factors will experience prolapse. For those suspecting they might have prolapse, it's crucial to ascertain whether the symptoms are indeed bothersome. If so, consulting a specialist, either a female pelvic medicine reconstructive surgeon or a urogynecologist, is essential. These medical visits usually encompass a detailed history, a targeted physical examination, and in some cases, further diagnostic evaluations such as urodynamic studies. Therapeutic interventions for vaginal collapse or pelvic organ prolapse are designed based on the severity of the condition and the patient's individual needs and preferences. Here are some of the common therapeutic interventions. Pelvic floor physical therapy. A trained pelvic floor physical therapist can guide women through exercises known as Kegels to strengthen the pelvic muscles. These exercises can help support the pelvic organs and reduce or alleviate symptoms. Vaginal pessaries. A pessary is a device placed in the vagina to support areas of prolapse. They come in various sizes and shapes. When fitted correctly, they can be very effective in managing the symptoms of prolapse. Vaginal surgery procedures can be performed through the vagina to repair the prolapsed area. Common surgeries include anterior and posterior colporrhaphy, vaginal vault suspension, and sacrospinous ligament fixation. Abdominal surgery procedures like sacrocolpopexy can be performed via an abdominal approach to provide support to the vaginal vault. This can be done with traditional open surgery or minimally invasive methods such as laparoscopy or robotic-assisted surgery. Hysterectomies, in some cases, removing the uterus, might be recommended as part of the treatment for prolapse. Lifestyle changes. Maintaining a healthy weight, treating and preventing constipation, and avoiding heavy lifting can help in managing and preventing further progression of the prolapse. Estrogen therapies. For postmenopausal women, topical estrogen therapy might help rejuvenate and maintain the tissues of the vaginal wall. Avoid straining. Women with prolapse should avoid activities like increased intra-abdominal pressure, such as heavy lifting or intense straining, to prevent exacerbation of the condition. Ultimately, the decision to treat or not remains in the hands of the patient. Proactive health management entails informed choices, as with any medical condition. Open dialogue with healthcare professionals is indispensable. It's pivotal to prioritize one's well-being, especially when it impacts quality of life. If you have any additional questions regarding vaginal collapse and pelvic organ prolapse, be sure to check with your gynecologist or message the OurDoctor channel, and I or another professional will get back to you with an answer and solution you deserve. Thanks for watching. Bye.